The bladder is a hollow muscular organ that's located in the pelvis. Its main function is to store urine, which is produced by the kidneys and transported to the bladder via two tubes called ureters. When the bladder is full, it sends a signal to the brain which triggers the urge to urinate. The bladder is a highly specialised organ and has several unique features that allow it to perform its function effectively. For example, it has a strong, flexible muscular wall which makes it able to contract and expand as it fills with urine. The lining of the bladder is also made up of several layers of specialised cells which prevent urine from leaking out and keeps the bladder healthy and free from infection. One of the most common conditions that can affect the bladder is urinary incontinence, which involves the involuntary leakage of urine. This condition can be caused by several factors, including pregnancy, childbirth, menopause, and certain medical conditions like diabetes or MS. It can also have a significant impact on the person's quality of life, but is also treatable with lifestyle changes, medications, or surgery. Another condition that can affect the bladder is a urinary tract infection, or UTI. UTIs are caused by bacteria that enter the bladder and can cause inflammation and irritation. Symptoms of UTI can include pain or a burning sensation during urination, frequent urination, and a feeling of urgency. UTIs can usually be treated with antibiotics, but it's important to seek medical attention if you suspect you have a UTI, as it can lead to more serious complications if left untreated. In some cases, the bladder may become diseased or damaged due to medical conditions like bladder cancer or cystitis. These conditions can cause a range of symptoms including pain, blood in the urine, and frequent urination. Treatment for these conditions may include surgery, medication, or other therapies.